Hey everybody, it's Jacob Williams here. Today is January 13th, 2019, and we're going to be going over the planes and directional terms for the body. Alright, so starting off with the directional terms, we have superior, which is the top, inferior, which is the bottom, proximal, which is the limb attached to the body that's closest to the top, distal, which is the limb attached to the body furthest away from the point of attachment. We have superficial, which is closest to the top of the skin. We have deep, which is closest to the center of the skin. We have medial, which is in the middle of the body, the center, where the sternum is. We have lateral, going away from the body, towards the ribs and the arm. We have anterior, which is the front of the body. And we have posterior or dorsal, which is the back of the body. Now we're going to be going over some regions of the body here. So we have the oculus, eyes, buccal, which is the cheek, the oris, which is the ear, nasal for nose, cervical, which is the neck, thorax, which is the inner chest cavity right here that you're seeing, the mamma, which is the pectoral or the nipple. You have the abdominal region, the umbilical region, which is in the center of the abdominal region. You have your hip, your pelvis in general, groin, pubis, femur. At the bottom here, you have your calcaneus. Okay, your hallucis, which is your toes, your tarsals, your crus, your patella, which is your knee, your palmar, which is the center of your hand, the palm, the pollex, which is the thumb, the carpus, which is the wrist, the antebrachium, which is the forearm, the antecubitus, which is the elbow, the brachium, which is the brachial part of the arm, the axilla, which is the armpit, the mentis, which is the chin, the oris, which is the mouth, and the facies, which is the front of the face. Now we're going to be going over some posterior regions of the body. So we have our cephalic region, which is the head, the upper limb, and the lower limb. For our spine, we have cervical, thoracic, lumbar, sacrum, coccyx. 5 regions. Okay, starting from the feet, we have the plantar, which is the sole of the foot, the calcaneus, which is the heel, sura, the sura region, sural, which is the calf, the popliteus, which is the back of the knee. We have the back of the femur here. We have the glutes, the manus, back of the hand, the antebrachium, again, the forearm. Okay, we have the olecranon, which is the back of the elbow, the dorsum, which is the back in general, and then the acromial region, which is shoulders. Okay, so that's the posterior. Now we're going to be going over our Play-Doh guy. So I'm going to set the skeleton to the side here. So there's 3 planes, sagittal, frontal, and transverse. We're going to be going over all 3. So I have 2 Play-Doh guys here, simply because the frontal region is the most difficult to cut for me personally. So for the frontal, you're going to take your knife, and you're going to travel all the way through your Play-Doh guy, splitting him in half vertically. Okay, his arms, his torso, everything. So he's going to look like this. So to put them back together, obviously you would just flip everything back on top of each other, like so. So that is your frontal plane. Setting this to the side. Next we're going to go over our transverse plane, which is cutting him in half at the hip. There's our transverse plane, which is a frisbee movement. Lastly, we're going to be going over our sagittal plane. So, we're going to take our Play-Doh guy and make one long cut vertically. Separating him in half. Okay, so those are the 3 planes, and those were all the regions of the body and the directional terms. I hope you guys enjoyed my video, and I will see you on the next one. Thank you.